Have you heard what's happening with Bruce Willis lately? He has what's called frontotemporal dementia. It's one of many neurodegenerative disorders. Neurodegenerative disorders. And that's what we're going to be speaking about today. Stay tuned. Hi guys, welcome back to my channel. Thank you for vibing with me here at Stethoscope and Stilettos. If you're new here at Stethoscope and Stilettos, we dive into all things health and all things fashion. Today we're going to be focusing on health, and thank you so much to my subscribers. And if you're new here, just remember to like and subscribe so that you get notified as soon as a video drops. When we speak about neurodegenerative disorders, we're basically talking about disorders that cause a decline in the functioning of the brain. And there are several of these disorders that I'm sure you've heard about a few in the past. Namely, we have Parkinson's disease, we have Alzheimer's disease, Huntington disease. We also have the frontotemporal dementia that I mentioned earlier that the former actor Bruce Willis is currently suffering from. And basically what's happening in his case is that there is atrophy of the frontal and the temporal lobes of the brain. And he's experiencing problems with speaking, with writing, and even understanding other persons when they speak or write. So it's a decline in his cognition and his mental capacity. But today we are going to be speaking specifically about Alzheimer's disease, mainly because it is very, very, very prominent in our society. And a lot of us, we see these conditions and sometimes you're not even sure that that's what's happening with this individual. So Alzheimer's disease is probably the king of neurodegenerative disorders. It's the most common cause of dementia in the elderly. And before we get deeper into this topic, I just want to highlight a bit about dementia, mentioning the word dementia, because dementia many times it's used interchangeably and in an incorrect way. When we talk about dementia, we're actually referring to a decline in cognitive ability, memory, or function with your consciousness intact. Basically, there's a decline in your ability to problem solve, to plan, to have executive functions executed, to have understanding or learn from activities that you would have done. So dementia is basically an entity by itself. You can have Alzheimer's disease and have dementia, or Alzheimer's disease is a form of dementia rather. Parkinson's disease is a form of dementia. Huntington disease is a form of dementia. As it relates to Alzheimer's disease, what really happens in this condition is that there is a formation of plaques on the hippocampus. The hippocampus is a structure deep within the brain that's responsible for memory, and these plaques are adhered to these areas. They're also adhered to the cerebral cortex, which is like the outer part of the brain. What happens is that these plaques, they multiply and they eventually cause deterioration in these areas of the brain. These plaques actually, they're called beta amyloid plaques, and they're formed from proteins or byproducts of the fluid that actually is around the neurons or your brain cells within there. And in certain conditions, they start to multiply and they adhere to the hippocampus and your cerebral cortex, and it causes a decline in the communication between these nerve cells. Hence all the symptoms that you would see following the decline in these patients. The actual cause for the plaques in individuals that have Alzheimer's disease is not known. However, there are persons that have a congenital predisposition to having the plaques formation, such as persons that are born with Down syndrome. They actually born with an extra chromosome 21, and they have an extra copy of these beta amyloid producing proteins. So they're like from the get-go, predisposed to getting Alzheimer's. Like, it's inevitable for them. There are other familial cases where you're born with certain genes or alleles that contribute to the formation of these plaques. In terms of how this condition is presented, there are several signs and symptoms you can look for, but there are several stages in the presentation of this disease, namely the preclinical stage. There is the mild, moderate, and severe stages of Alzheimer's disease. Firstly, the preclinical stage, you see no signs or symptoms. This person can be walking around pretty normal and not display any sort of cognitive decline. However, if you were to do a scan of their brain, you would see that these plaques that I mentioned earlier, these beta amyloid plaques, have already been formed on their hippocampus and the cerebral cortex. The thing is, Alzheimer's disease begins decades before any signs or symptoms can be displayed. So a lot of people are in preclinical stage and they're not even aware of it. A 3-year-old can be well on their way to having Alzheimer's disease. The next phase we have is the mild phase of the Alzheimer's disease. This is where clinical diagnosis usually occurs. Patients begin to show certain signs of symptoms. They start to have loss of memory. They start to have difficulty remembering familiar places. This is where they start getting, lost. They forget how to get home, how to get to the grocery store. There's just this slight decline in their cognitive abilities. These growing number of plaques and tangles that occur in the cerebral cortex and on the hippocampus, they initially start to damage the parts that are relating to your memory. And secondly, they start to attack the parts relating to your physical functioning. And once these signs are identified in a patient, it's critical that you seek medical attention before things get really, really bad. And one thing we'll need to rule out is depression. Because as I mentioned, dementia could show up in a lot of areas. It doesn't have to be Alzheimer's disease. These are signs of cognitive decline, aka dementia. And once you would have sought medical attention and we can investigate these symptoms, you were able to rule out if the patient has Alzheimer's disease or some other cause of this dementia. And one of the biggest diagnostic differential is depression, because depression can occur with this cognitive decline. So you need to seek medical attention once these signs or symptoms would have been identified. Next, we have moderate Alzheimer's disease. This is where the damage starts to progress. It gets farther into the damaged areas. You would have atrophy of the damaged areas. You'll also find that this patient starts to wander. This is the time where they will get agitated, they start to wander off. And just to share a little bit about myself, my grandmom actually passed away from this condition. And I recall this one time that she just wandered off and we couldn't find her for at least 24 hours. So it's a very scary time for family members when you see a loved one that is experiencing these conditions. And it usually happens in the late afternoon. For whatever reason, that's when they decide to wander off. These patients also experience hallucinations, suspicions, paranoia. My grandmother also experienced these symptoms. She would talk to things that weren't there, and she would be very paranoid about a lot of things. These patients also have problems with organizing their thoughts. They lose sense of impulse, where someone with Alzheimer's might believe it's okay to get undressed in public just because they feel hot. They forget the fact that that's something inappropriate to do. These persons with Alzheimer's, it's really hard on the family members or the caregivers because they exhibit anger, and that anger really masks the fact that they can't do what they used to do. Like, just imagine waking up one day and you can't remember how to, shower yourself. You can't remember how to comb your hair, brush your teeth. These daily, regular tasks that you usually do, you no longer you're able to do them. For all the caregivers out there of persons that have Alzheimer's disease, we see you, we feel for you, we hear you. And I would hope that this video would help you to understand better their position and to not ill-treat these elderly people with the Alzheimer's, because that's what happens most of the time. There are a lot of ill treatment because most of us don't understand what's going on, and you just think that they're doing these things on purpose. So let's learn, let's share this information, let's become more aware. Consequently, the risk of homicidal and violent actions occur with these patients. So in the moderate phase of Alzheimer's, you need to have close monitoring of these patients because they could get very aggressive, very angry, and they can have, homicidal cases occurring. Next, we have severe Alzheimer's disease. By this point, the cerebral cortex, the brain, has atrophied. Atrophy just means it's gotten smaller, it's shrunken in size, and the damage is widespread. These patients basically seem to have lost all form of self, and they would experience excessive weight loss, infections, they can't control their bladder. They would experience extra sleepiness. Patients may be in bed for a longer period of time than you would expect. And usually these patients don't die specifically of the Alzheimer's, but they have secondary conditions that would happen, like pneumonia may actually directly be the cause of their death. As it relates to diagnosing these patients, according to the American Neurology Academy, the CT scan and the MRI are two imaging techniques that are top of the line to detect lesions that may lead to cognitive decline in patients. You might be wondering what you could do to prevent becoming prey to Alzheimer's disease. What modifiable factors? Interestingly enough, there was a study where investigators analyzed the data for the patients 45 years of age and older that were exposed to a certain amount of modifiable factors, namely hypertension, diabetes, depression, the ability to meet your required aerobic physical exercise, hearing loss, cigarette smoking, and binge drinking. What they found in this study was the highest amount related to hypertension. Those patients were at the highest risk of having Alzheimer's disease, and the lowest was found among those who binge drink. So those are some modifiable factors or areas that you could work on, that if you maybe fall under one of those, you could take into consideration. In terms of management, treatment of this condition, as I mentioned earlier, it's incurable. So what you basically would do is manage symptoms, and if there's secondary conditions that arise, such as depression and hallucinations, treat symptomatically with antipsychotics and these things for these patients. In addition to the modifiable factors that I mentioned earlier, I'm going to leave with you 5 pillars of brain health that you can work on that could put us in a better position to avoid, falling prey to Alzheimer's disease. Number 1, you need to move. Try to exercise at least 3 times a week, at least 30 minutes of aerobic exercise each time. You need to nourish. Try to eat healthier, avoid the carbs, avoid the sugars, relax. Sleep is so important, it's so essential. It's known that one night of bad sleep could actually cause the formation of these beta amyloid plaques. So make sure you're getting enough rest, enough sleep, so that you could have better brain function. The next one, connect. Be sure to have a community of friends and family with healthy relationships. Go out and do not isolate yourself. Isolation is like one of the worst things you can do. We need each other, so make sure you connect. And lastly, discover. Learn something new. Try writing with your non-dominant hand. Learn a new language. Challenge your brain mentally. Read a lot of books. Play games. Do something every day that you are challenging your brain to work harder. So just take into consideration these 5 pillars of brain health, and let's be on our way to healthier, more fabulous lives. Thank you so much for vibing with me here at Stethoscope and Stilettos. Until next time, see you later. Bye-bye.